Life after stroke. There is life and hope after stroke. With time, new routines will become. Rehabilitation can build your strength, capability, and confidence. It can help you continue your daily activities despite the effects of your stroke. Depression and stroke. Depression is a common experience for stroke survivors. It's often caused by biochemical changes in the brain. When the brain is injured, the survivor may not be able to feel positive emotions. Depression can also be a normal psychological reaction to the losses from stroke. Here are some of the common symptoms of depression. Persistent sad, anxious, or empty mood. Restlessness and irritability. Feelings of hopelessness, pessimism, guilt, worthlessness, or helplessness, loss of interest or pleasure in hobbies and activities. Decreased energy and fatigue, and feeling slowed down. Difficulty concentrating, remembering, and making decisions. Insomnia, early morning awakening, or oversleeping. Appetite and or weight changes. Negative thoughts about life. Depression may make the rehabilitation process more challenging for survivors to do the hard work required. If 5 or more of these symptoms persist for longer than 2 weeks, depression may be the cause. A good psychologist or psychiatrist can help. Treating depression not only improves the survivor's mood, it boosts physical, cognitive, and intellectual recovery. Social support is also crucial. Several studies show that depression goes hand in hand with lower levels of support. Look to your family, friends, a stroke support group, or a combination of resources for help. Everyone involved in recovery needs to be aware of the survivor's depression and ready to respond to it. The right kind of treatment and support can help ease the pain and move the survivor down the road to recovery. Around 1/3 of people who have had a stroke will experience depression. This can arise due to social isolation or biological factors. However, treatments, such as psychotherapy, antidepressants, and light therapy, can help. Depression after a stroke may occur due to biochemical changes in the brain from injury resulting from the stroke. Let us discuss what stroke and depression are, how the two are connected, and treatments for depression after a stroke. What to know about depression after a stroke? One in 4 stroke survivors have a chance of developing serious depression as a side effect of stroke. If you are feeling sad, hopeless, or helpless after having suffered a stroke, you may be experiencing this. Other symptoms of depression may include irritability or changes to your eating and sleeping habits. Talk to your doctor if you are experiencing any of these symptoms, as it may be necessary to treat with prescription antidepressants or therapy. Along with medication and therapy, a lot of research shows that a few simple changes help relieve the symptoms of depression. If you or a loved one is having a difficult time coping with the emotional repercussions of a stroke. Tips on how to implement positively and resilience. Attend a support group. Talking about your struggles with people in the same situation makes you feel less lonely and can offer helpful insight or different approaches to dealing with difficulties. Eat healthy food. A good diet is important for your general health and your recovery from stroke and can also improve your mental health. Remain socially active. Although you may not be able to do as much as you used to, it's crucial to stay in touch with family and friends and take part in social activities. Be as independent as possible. Humans need to feel independent and competent. In stroke recovery, you may require the help of caregivers, but if there are things that you can safely do by yourself, insist on it. Exercise regularly. Physical activity, especially a low-impact one like walking, is proven to boost mental health and will also contribute to your recovery. Please subscribe to my YouTube channel SDK Online Stroke Awareness.